First community conversation today, we're joined by Dr. Eric Dowling, an otolaryngologist at UVA Health. He's sitting down with Casey.
Thank you so much, Steve, and thank you so much for taking the time to be here today. So, we're talking a little bit about some of the most common risk factors for thyroid cancer. What would you say some of the most common ones are?
Yeah, thyroid cancer is a little bit unique. So the thyroid gland is an organ that sits right over the midline of the neck, over the windpipe. And unlike other head and neck cancers like mouth cancer or throat cancer that we typically think of being associated with smoking or alcohol use, thyroid cancer doesn't have any association with modifiable risk factors. There are a couple of risk factors that have been shown to be associated with thyroid cancer. The main ones being having a first-degree relative with a history of thyroid cancer or significant exposure to ionizing radiation early on in life.
Okay. So what can people do, if anything, to reduce their risk?
So because thyroid cancer can't be directly prevented, I counsel all of my patients about maintaining an overall well-being, which includes routine physical activity, eating a diet rich in fruits and vegetables. And because it can't be directly prevented, I advocate for early detection of thyroid cancers. So knowing the signs and symptoms, getting routine examinations by your primary care provider to identify nodules, and knowing your risk factors.
Okay, and you mentioned symptoms. What are some symptoms that might signal that someone should get checked out?
Sure. So thyroid cancer can be a little bit tricky because it often presents without any signs or symptoms. Oftentimes thyroid nodules are identified incidentally on imaging that might have been ordered for a completely separate reason. But when symptoms are present, the most common ones would be having a lump or a nodule near the midline of the neck. And in more advanced cases, patients can have persistent hoarseness of their voice, shortness of breath, or difficulty swallowing. So these symptoms aren't specific to thyroid cancer, but patients should trust their body, and when they have persistence of these symptoms, they should seek evaluation.
Right, it's better to be safe. And what treatment options are available if someone does find something on a scan?
Sure. So thyroid cancer is a multidisciplinary problem. It starts in the primary care provider's office with identification of the thyroid nodule and appropriate referral to specialists, and that extends all the way to our multidisciplinary thyroid tumor board at UVA, which includes other surgical oncologists like myself, medical oncologists, radiation oncologists, endocrinologists, pathologists, and radiologists. And when a thyroid nodule is identified, the next step in management is to get a thyroid ultrasound, which can give us some insight into the size and characteristics of the nodule that can help us determine the likelihood that this is a malignancy. And if warranted, we'll get a biopsy of that with a small needle into the nodule, and that'll help us determine the risk for cancer in that nodule. And if cancer is identified, the mainstay of treatment involves surgery, which might include a thyroid lobectomy, which is removal of part of the thyroid gland, a total thyroidectomy, which is removal of the entire thyroid, and at the same time we may remove some lymph nodes in the neck at the same time if we suspect that those might be involved. In some cases, depending on the type and stage of disease, we may advocate for addition of something called radioactive iodine after surgery, which is used to ablate any microscopic remnants of thyroid tissue that might remain. And one of the more exciting advances with regard to thyroid cancer treatment is the use of targeted therapies, which involves getting mutational analysis of a patient's thyroid tumor that can help us identify specific markers on that tumor, and we can give medications that are targeted specifically for that mutation. And we've shown good results, particularly in patients with far advanced disease, which was previously thought to be incurable, and we'd have some regression of disease and have been able to cure patients in some cases.
That's amazing. It's really, really good news. Thank you so much for taking the time to be here today.
Thank you.
Yep.
Appreciate it.
We'll have you back soon. And Steve, back over to you.